Hi, my name's Sue Mallett. Welcome to this short course on designing diagnostic test accuracy studies, the absolute essentials you need to know. I work at the Centre for Medical Imaging at UCL in London in the UK, and I'm going to share with you important tips I've learned in designing these studies over the last 20 years. The introduction to diagnostic accuracy studies is a series of short videos, each highlighting a key learning point. In each video, there are short activities where I encourage you to pause the video and think. If you're watching with colleagues, this is a great opportunity to discuss together. And after each activity slide, I'll share with you my thoughts and insights. So let's start here right at the beginning. Here are 3 people who've turned up together at their family doctor. Here's a family doctor. And the father starts a conversation. I'm concerned about a cough that doesn't go away. Doctor, is it serious? What's wrong? And the doctor might ask questions like this. First, please tell me who's the patient. So the doctor's trying to work out, is it his mother, is it the father, or is it the baby? How long have they had this cough? And what other symptoms have they had? So in this first video, what we're going to do is we're going to talk about who is the patient, who do I recruit in a study? And this is a really essential, important aspect of studies. Before we get there, we're just going to have a quick look at some of the words that are used in diagnostic accuracy studies. So diagnostic accuracy studies, we typically need to describe several components. One is the participants, which is what this video is about. The other one is something called the index test, which is a test we're interested in. And then we actually want to know how good the index test is. And so we need to compare it to something. We need to compare it to a reference standard. And that's the best test we've got for diagnosing the target condition, which is the disease we're interested in. And the fourth component are the outcomes, and these are how we're going to actually express the results of the diagnostic accuracy study. Okay, so we'll come back to these different components. And in the first pause and think exercise, we're actually going to learn how to use 3 of these words. We're going to learn how to use index test, target condition, and reference standard. Okay, so for this pause and think exercise, what I want you to do is find these 3 words, these 3 concepts behind these words in the study objective below. So the objective is diagnostic accuracy of persistent cough for diagnosis of lung cancer. And persistent cough I'm defining as a cough that doesn't go away. Okay, so what I want you to do in this pause and think exercise is to work out what's the index test you're trying to measure the accuracy of in that objective, what's the target condition, what's the disease you want to diagnose, and what's the reference standard. Now, the reference standard is not actually in that objective, but I think just have a go, because I think you probably know a few things from your current knowledge. Okay, so pause the video. If you're with someone else, have a quick conversation about this. I'll join you again after you've had a chance to pause the video, and we'll talk about it. Okay, welcome back to the pause and think discussion. I hope you took the opportunity to pause the video and have a think for yourself, and hopefully discussing with a colleague. Okay, so the first thing we were looking at was what's the index test? And so the index test is a test you're measuring the accuracy of. So let's have a read of this objective. Diagnostic accuracy of persistent cough for diagnosis of lung cancer. Okay, the test we're trying to look at the diagnostic accuracy of is the persistent cough. So that's our index test. The second bit we were trying to work out is what the target condition is. So this is the disease that you're aiming to diagnose. So let me read the objective again. Diagnostic accuracy of persistent cough for diagnosis of lung cancer. Okay, so the target condition is lung cancer. Okay, now the third concept is the reference standard, and this is which test or tests you're going to use to confirm the disease. Now that's not in that diagnostic objective, but maybe you know or have an idea from your regular experience. And yes, you're probably going to use some sort of imaging test to work out if there's a cancer in the lung, chest x-ray, CT, something like that. And if you find something, then you need to work out whether the mass that's seen on the imaging is actually cancer, and so that's typically a biopsy and then histology. To look at histology is where you're actually looking at the cell type. Okay, great. Okay, so let's go back to our main objective for this part 1. We've looked at the basic terms. Now we want to look at who we're going to recruit. So you remember this scenario we looked at the beginning, where the father's come to the doctor, and with him is his mother, and then the baby. And he said, "I'm concerned about a cough that doesn't go away. Doctor, is it an illness? What is the disease?" And the doctor's saying, "First, please tell me who the patient is." Okay? And so a persistent cough can mean something very different from if it's in his mother, if it's in himself, and if it's in the baby. Okay, so if we're doing a study to look at the diagnostic accuracy of persistent cough for diagnosis of lung cancer in primary care, that's at the family doctor, which of these patients might you enrol and why? Okay, so what I want you to do is to look at these different patients here. We've got all the patients in primary care, so there's all of the people who go to their doctor. This is babies, this is intensive care patients, this is heavy smokers, and this is concerned older patients attending primary care. Okay, so I'd like you to pause the video and have a little think about which of these patients would you enrol for this study objective and why. Hi, welcome back to the Pause and Think discussion. Okay, what we're trying to work out is, for this objective, what is the diagnostic accuracy of persistent cough for diagnosis of lung cancer in primary care? Who are we going to enrol? Okay, so the first thing we need to know that for the diagnostic accuracy to be useful, the studies need to be conducted in patients representative of the normal clinical practice. And this would be unselected patients who would usually get the test. Okay, so let's look. Babies. That was the first one I looked at, and I thought, do I want to have babies in this study? Okay, so lung cancer, babies. No, babies are too young to get lung cancer, at least not the regular lung cancer that we're used to. There may be a few specialist, very rare lung cancers, but we're talking about lung cancer that affects older people. So babies are not a good set of people to enrol. Okay, who else was not good to enrol? I thought I'd eliminate a few before I started drilling down. So I eliminated intensive care patients. Now, we're interested in the diagnostic accuracy of patients attending primary care, and the patients who are in intensive care are an extreme patient group, and they're not representative of the people attending their doctor because, frankly, they're already in the hospital. So they're not in a position to go to see their doctor because they're under the care of the hospital doctors. Okay, so again, this is not a helpful group for this study. Okay, let's have a look at who else we've got. So then when I was thinking about the other sets of people, I was thinking, is the test going to be used for screening asymptomatic people, or is it for the diagnosis of symptomatic people? Okay, so this is really a question about what's the role of this test in primary care. So if we wanted to look at people who are asymptomatic for screening, we might either pick all patients in primary care, or we could pick the heavy smokers. Now, the heavy smokers are the people who have a higher prior risk. We know that from lung cancer is primarily caused by smoking. Okay. But if we were interested in people who had symptoms already, then we would be looking at these concerned older patients attending primary care, because they're concerned because they've probably got some other symptoms they think might be connected with cancer, and that's why they're turning up at their GP with this persistent cough, worried about it. Okay, so now we've addressed this first question that the doctor had. First, please tell me who is the patient. Okay, and what we'll find out in the other videos is these other questions about how long have they had this cough and what other symptoms are also really important parts of testing a diagnostic test. Okay, so test accuracy depends on the patients, it depends on the healthcare setting, depends on the role in the clinical pathway. We saw that for the screening of asymptomatic versus the testing of symptomatic patients. It depends on the target condition, this cough is for lung cancer, and it depends on the test methods, how you're going to actually record that persistent cough. Did you do well with the activities? Well done. And I'll see you in part 2, the importance of clinical pathway. If you feel you'd like some more practice getting those words for diagnostic accuracy correct, go to the list of the Cochrane Diagnostic Test Accuracy Systematic Reviews. Find a title you're interested in and have a go at identifying index test target conditions and participants. And then you can go to the summary of findings table and check your answers and find the reference standard. So here's a web link for you to be able to get through to those reviews. And see you in part 2, the importance of clinical pathway.